What I think is the punchline is more about using technology for plain old communications. Not just patient to patient or patient to physician, but patient to peer, patient to family. Every imaginable type of connection can be made through the web. And going back to John Jardine for a moment, the first step most people take is that search. 60 billion a month on Google. 2 years ago, Google had indexed or recorded over 1 trillion web pages. It takes me only 1/3 of a second to find some information on child cough, on that particular search phrase. It takes me a minutia of a second for Google, or I should say it takes Google a very tiny, tiny portion of a second to sort over 2 million web pages on that topic and give me some information about the most complicated topic I could think of. By the way, I wanted to mention 23andMe in here as something not for discussion in this presentation, but for those who are interested to go and research. Wired magazine did a story on this a few months ago. The co-founder of Google has started this organization, and he is amassing data, actually health records, of over 10,000 Parkinson's sufferers. And the idea is to use that as a database to do real-time searches and try to come up with some conclusions about what kinds of treatments work best. In the article, they discussed a test that was done where in about 20 minutes they found an association between Parkinson's and another disease, I think it's called Gaucher's disease, that supported almost to the 10th decimal place the same findings that a 10-year study took in a real medical trial. So it's worth checking out. If you'll just Google it, you'll find the website. I believe it's 23andme.org. Very interesting how mass amounts of data can be used, I think, for health research in new ways. All this is made possible by Web 2.0, and all that means is that with Web 2.0, we now have computers that can talk to each other through languages and platforms and technology that allows information stored on those computers to be changed. Remember, Web 1.0 was mainly static. It was one-direction information. You built a web page. It was like printing a brochure or a book. You displayed it. That was the end of it. Now, Web 2.0 means you can talk to a computer from your computer. You can make changes to that web page yourself. You can make comments. It'll be recorded on there for the next person to see. That's all that is. What this has spurred, of course, is social communities. And this means patients are now much more medical end users, as one researcher said. And it's because so many of us suffer from disabilities, chronic diseases. At least the majority of us who have one of 17 health problems go online regularly to look at it. Roughly 4 out of 5 of us who have no health problems go online to research health. And this is coupled at the same time with the explosion in social media. A couple of weeks ago, as we all saw in the news, Facebook became the most popular website on the internet. So coupled with this, of course, and as evidence of it is WebMD, which is going on 15 years of age, I believe. I'm quite familiar with it. The founding editor is an old colleague and friend of mine. He now works with our company. So I know it well. I've had a good inside look at it over the years. 2.5 million pages on that website that draw 1 billion web page views every 60 days. A web page view, by the way, is just each time a web page is seen or displayed for somebody to watch. They used to call these hits back in the old days, although that's a little bit of an inaccurate word for it. So every 2 months, 1 billion pages are viewed on this website. Interestingly, the hottest area of growth in WebMD, my friend has told me, is disease groups, where you can go in and essentially become part of bulletin boards, interactive discussions, depending on what kind of illness or condition you are interested in discussing. And now we have continuing medical education on WebMD. And that was one of the fastest growing parts of the web itself. So now even WebMD is much more than a dictionary, a medical encyclopedia. It's really a place for people to go and interact and communicate with each other. So all this stuff out there on the web, what is it people are looking for? About 8 years ago, there was what I consider to be a seminal study of just that. And this was a group in England that followed a number of menopausal and premenopausal women through the process, observing them doing research on the internet about menopause. And what they found was there were basically 3 different phases that people go through when they go to the internet to evaluate whether they want to consume any of that information. The first one is very, very gut, very intuitive, heuristic. That means they basically look at the page and based 94% on visuals, decide whether they want to stick with it. Is it professional? Does it look good? Does it look like it was done by professional communicators? They're really just throwing away pages. They want to make sure what they keep is good, but they want to throw away the bad stuff first. So that's the first step, and that happens very quickly. The next stage is much opposite of that. It's evaluative based on the information, the printed information usually that's on the page. 83% of their factor is based on what they read. Is it trusted? Is it sponsored by a pharmaceutical company? Is it something that I feel like I can use and believe in? And lastly, there's some social identity. The web pages they really stick with over the longest period of time, to them, give them a feeling that it's personalized for them, and that it also affords them an opportunity to have online relationship building. One of the people I had look at some of the online PHR sites like Google Health said that was the thing she most missed in all 3 of those services that I mentioned earlier. It's not really an opportunity, she felt, not enough of an opportunity to really have communities and to have peer-to-peer communications. So this is what people look for. They want a site they can trust, information they can trust. They want a page that isn't commercialized. And they want something that they feel is very authoritative in the medical sense. We have somebody here in Denver, a physician, who's been part of pioneering that same kind of effective healthcare communications, and his name is Dr. Dan Fighton. He is a pediatrician, and many years ago he had a mentor by the name of Bart Schmidt, another very well-known pediatrician here in Colorado. And Dr. Schmidt noticed in the 1970s, as he was overseeing the Children's Hospital Call Center, what a chaotic situation it was to have parents constantly calling in, worried about their children. And any of us who've had children know that kids can get sick and seem quite ill sometimes when it's not really that serious a condition. But of course, especially new parents are going to call for help very quickly. And this was overwhelming the Children's Hospital Center that was looking out for 120 doctors. So Dr. Schmidt said, we need to come up with a series of questions, an algorithm to ask these panicked parents really what's going on in a more thoughtful, quick, efficient manner so we can triage the callers. The really serious cases need to be sent to a doctor. We need to page a pediatrician. The least serious cases, certainly, we can give the parents some further instructions on what to do. So that began in 1970. In, I believe, 1980, his protocols, his algorithms, were sold to Little Brown and Company, and it's now published worldwide and in use in over 20,000 doctor offices nationwide. So it's been a runaway success in terms of healthcare information. Along comes Dr. Fighton in the late 1990s. Dr. Fighton's one of those internet guys, internet doctors. He's really into it, and he's got it wired, literally. He said, hey, this could work online. Do we really need somebody calling to make this work? I really like Dr. Fighton's web presence, first of all. When I went to his website, you can see for yourself. He has a little personal profile, and he talks about the things that I love. The soft skin of a precious newborn, the gentle kiss of a toddler, the interchange of ideas with an adolescent. I guess that's why I'm a pediatrician. And would you send your kid to this doctor or what? He's got my vote. Anybody wants to talk to a teenager? Hey, have at it. So Dr. Fighton already has a great web presence, one that I admire very much. But what he really has on his website that I like so much is really the electronic version of the protocols that Dr. Schmidt developed nearly 40 years ago now. When you go to greenwoodpediatrics.com, you'll find over on the right a little box that asks, is your child sick? and you enter in any number of a selection of symptoms, press go, and it gives you a guide, essentially a summation of the triage that Dr. Schmidt developed. And you can find out if the cough is serious enough to require further medical attention, or if maybe some Robitussin might be the answer to it. It's a very nice, easily used triage table. There's disclaimers, of course, about not giving medical advice, all that. And of course, at the end, there's a nice little additional interactive feature where you're able to say how useful this was. So what has this done to his practice? Has it wrongly caused the deaths of thousands of children who've missed out on medical care? Did emergencies go unattended to? Did anyone suffer? Well, no, not to Dr. Feighton's knowledge. And in fact, over the last 5 years they've had this in place, they have seen a growth in their practice of 25% in patients. And yet the number of after-hours calls to their practice has not increased. So by my math, and maybe somebody can help me here, this has resulted in a 20% reduction in calls to doctors. Doctors can't take a lot of phone calls in a day. They got a lot of patients to take care of, especially the primary care doctors. This is one way to make their time much more efficient and effective. So this is basically what I think is virtual doctor talk. Unfortunately, the doctor talk that you find on an airplane these days is increasingly like steakhouse talk, and not so much about what you want to talk about. We can talk about sex if you like, as WebMD is willing to do, or willing to have you do. Has your sex drive stalled? You know, okay, I'll take a look. But it's on my terms now. It's not so much like steaks are sold. This is what patients want. They want Bob Gallner talking to them. They don't want the model smiling at them. They want instant information that applies to their situation. They don't want an intrusive advertisement. This photo on the right, I took on my cell phone in a bathroom in a Denver club. It's a bar and restaurant. I wasn't at the bar. I was having dinner. In this case, it was breakfast, actually. Went into the bathroom, and there on the mirror, right in front of the lavatory, was a Corona beer commercial. Video playing right in front of me. Everybody's seen it, the two babes on the beach with the footballs flying in. And I thought, is there any place we can go now without somebody pushing a message at us?